We're here to promote cnsupdates.com, which is a website for medical professionals interested in neurology. Our latest masterclasses focuses on narcolepsy and restless leg syndrome. The courses are being presented as a virtual masterclass featuring leading specialists from around the world.
I began this pathway during my training in neurology in the United States, a residency program to become a clinical neurologist. And the program I was in the early 1980s had a year devoted to the study of neuropathology. And during that year, I began to be able to see the brain tissue of people who died with dementing illnesses, including Alzheimer's disease. And about that time, it was becoming clear that as the population was aging, those illnesses, which then were little understood in the early 80s, were going to become a major factor. So I then came to Washington University in St. Louis in Missouri to study how we might treat neurodegenerative dementing illnesses, and that led me to join the dementia program there in 1984, and I have done that ever since. So this will take a little explanation. We have had, in the past 30 years of Alzheimer research, very few truly effective therapies for Alzheimer's disease, maybe none. We have some drugs that may help the symptoms of Alzheimer's disease temporarily, but no treatments that truly alter the disease course or arrest the disease course. It's been a very discouraging environment because we think in these past 30 years that we have increased our understanding of the disease mechanisms that cause Alzheimer's disease and have what we think should be good treatments based upon those mechanisms, but they all have failed when tested in individuals who have Alzheimer's disease dementia. So there may be three reasons for that. One, the drugs may be ineffective, may not be very good drugs. I don't believe that, but that's possible. Two, the targets that the drugs attack may be the wrong targets. That's possible. But three, it may be that we're administering those drugs too late in the disease course. So all of these drugs have been given to people who already have the symptoms of Alzheimer's disease, but we know that at the time symptoms begin in certain areas of the brain that are highly vulnerable to Alzheimer's disease, already 50% of the nerve cells are lost or destroyed. So by the time we give the drugs, we're treating a damaged brain. And maybe that's why the drugs don't work. So to try to address that, we have to realize that there's a stage of Alzheimer's disease where the brain lesions process has been occurring, but in the absence of any symptoms, not enough yet to cause the dementia caused by Alzheimer's disease. We call this phase the preclinical stage. And we think it would be good to use the drugs we have now in that preclinical stage before there is marked brain damage, and maybe then we can prevent Alzheimer's disease dementia. So that's our goal. The problem is, in older adults, even if we now have ways, biomarkers, to demonstrate that they are beginning to have the brain lesions of Alzheimer's disease, we don't know if they continue to live, they will develop dementia, or when. We don't know when we would treat them with these prevention strategies. But there's a special group of Alzheimer individuals who develop the disease because they have a mutation that causes the illness. So it is very difficult to do a prevention trial in healthy older people, not knowing of them who is going to develop Alzheimer's disease symptoms or when. We have biomarkers now. This is a revolution. We can test and see who has the brain changes of Alzheimer's disease even before there are any symptoms of memory loss or cognitive decline. But we don't know if every older adult who has these brain changes will necessarily develop Alzheimer's dementia. So we would give drugs to people who may never develop the dementia, and yet we would expose them to the side effects of the drugs. So the DIAN study, Dominantly Inherited Alzheimer Network, takes a very special group of individuals who develop Alzheimer's disease because they have a bad gene that causes it, a mutation. And we know everybody who has the mutation will inevitably develop Alzheimer's disease dementia. It is virtually 100%. These individuals typically get early onset dementia, around 50 or 40 or even in their 30s. And they develop the dementia at about the same age their parent who had the mutation and passed it on to them developed it. So if someone's father who was affected with Alzheimer's disease dementia and had the bad mutation developed Alzheimer's dementia at age 45, we can tell by genetic testing in that father's offspring who inherited the mutation, and we know that if they inherit the mutation, they will develop Alzheimer's disease dementia at about the same age as the father. So if they're 40 years of age, and we know they have the mutation because of genetic testing, we know we have about 5 years to administer the drugs to try to prevent the dementia. Does that make sense? But the problem is there are very few of these families with the mutations across the world, maybe 500 or so families across the world. So no one center, no one academic program has enough of these families to make much of an impact. So the DIAN project is to take these centers following these few families and study them all in the same way, same procedures, same images, same fluid assays, same testing, and combine them in one large network. That's the Dominantly Inherited Alzheimer Network, an international study of this inherited form of Alzheimer's disease. So I mentioned already that even in older people who don't come from these rare families with these mutations, we can test older healthy people with biomarkers and see who has the beginning changes of Alzheimer's disease in the brain. But I also said we don't know that that means they will progress on to develop dementia or when. And we then would say, I don't know if those biomarkers mean that person is going to develop Alzheimer's dementia. Maybe they're reflecting some other process. What we did in DIAN is use those same biomarkers and evaluated asymptomatic individuals, and we found that they did become abnormal, but only in the people who carry the mutations. So we know the people who carry the mutations are will develop Alzheimer's disease dementia, So it means these biomarkers, in fact, are showing the Alzheimer process. None of the people in the Diane who come from these same families but did not inherit the mutation, none of them have any biomarker abnormalities. So this says, yes, these same biomarkers that we see in older people do predict who will become demented. And we can use the Diane cohort to validate that. So there are at least 2 other studies in addition to Diane that want to move into the area of trying to delay the onset of dementia or even prevent it. One study that is similar to the Diane study is called the Alzheimer Prevention Initiative. It is led by Drs. Eric Ryman and Pierre Theriault at Banner Health System in Phoenix, Arizona, and they will test a family that has a mutation causing Alzheimer's disease dementia about age 45, and it's the largest known family of this sort, maybe 3,000 people at risk for developing Alzheimer's disease. It's in South America, in Medellin, Colombia. And they're going to be testing drugs to try to prevent it in that family. So very much similar to Diane, except Diane will be international, and they're going to focus on that. Then there's one other group led by the Alzheimer's Disease Cooperative Study in the United States that will take healthy older people who have brain changes of Alzheimer's disease as shown by specialized imaging and try to give them drugs to prevent Alzheimer dementia. So there are 3 studies, Diane, Alzheimer Prevention Initiative, and this Alzheimer's Disease Cooperative Study. They call it the A4 study. It's led by Risa Sperling and Paul Azen, all trying to delay or prevent Alzheimer dementia. This is the most exciting time in Alzheimer's disease research in the past 30 years. We have the tools, we have the drugs, and now we have the samples, the people, the research participants, to try to see if we can prevent Alzheimer's disease. The first participant in a study to prevent Alzheimer's disease dementia is going to be given the first drug this month in Diane at Washington University in St. Louis. We now are starting the era of trying to prevent Alzheimer's disease. We never will stop trying to cure Alzheimer's disease in people who already are demented. We're not abandoning them. But like many other diseases, it's much better to try to prevent than wait till the disease is there and try to treat. So we're going to do both, but now we've started on the path, changing the paradigm from just curing to also including prevention.